Greetings, my name is Barclay Sachose, Senior Health Consultant from Moose Healthcare. Today, I want to tell you more about prostate enlargement. In this video, I'll tell you what BPH is, causes of benign prostatic hyperplasia, symptoms, complications, and treatment. If you have BPH, benign prostatic hyperplasia, your prostate gland is enlarged. This is a walnut-sized gland beneath your bladder. The prostate gland surrounds your urethra, the tube in which urine and semen passes through, exiting your body. In normal urination, urine flows from your bladder through the urethra in the prostate gland. In a young man, the prostate gland is a walnut size, but as men grow in age, after 40s, their prostate gland starts changing in size. It starts growing in size due to hormonal changes and some other reasons. As it grows, it compresses the urethra, the tube in which urine passes, and this leads to difficulties in urination. As it grows, it compresses your bladder, which leads to reduced urine flow. Left untreated, it grows even more, which blocks your urethra even more. And this leads to failure in emptying your bladder. But who can suffer from BPH, benign prostatic hyperplasia, or prostate enlargement in simplest terms? Every man above the age of 40 is likely to suffer from BPH. If you have family history, maybe someone, your father, your uncle, in your family, someone struggled with prostate enlargement. And other health complications like obesity, high blood pressure, diabetes, erectile dysfunction, and lack of exercise. But what are the symptoms of BPH? Failing to empty your bladder, frequent urination, frequent urge to urinate, weak or interrupted urine flow, straining to urinate, and blood in urine. But what are the complications of benign prostatic hyperplasia, prostate enlargement? Number one, inability to urinate. You are trying to pass urine, just imagine you're failing. Damage to your bladder and damage to your kidney. Bladder stones and blood in urine. Let's talk about treatments. If you are experiencing mild symptoms of BPH, the first treatment is a watch-if waiting. At this point, your doctor may recommend a regular checkup, trying to monitor the prostate gland, seeing if it's growing or not, seeing if it keeps on growing or not. Your doctor may recommend an annual checkup, maybe every after 3 months, every after 6 months, to watch how it's growing. But that is not a solution, honestly. Waiting for the problem to even grow bigger, that's what you're doing. And when it gets to moderate stage, after waiting for it, your doctor may recommend alpha blockers or PDE5 inhibitors. All these medications relax your prostate gland, which can improve the urinary flow. This is not a lasting solution. And if these medications fail to help, your doctor may recommend 5-alpha reductase inhibitors. Now, this helps improving the urinary flow by reducing the prostate gland size. But what are the side effects of these medications? Low blood pressure, dizziness, low sex drive, erectile dysfunction, and depression. But what happens if these medications fail? A surgery known as transurethral resection of the prostate, TURP, will be recommended. In this surgery, A resectoscope is used to shave off the tissue of the prostate gland, widening your urethra. If your prostate gland is too enlarged, an open prostatectomy is recommended. In open prostatectomy, the tissue in your prostate gland will be removed and then to be closed again. This is also not a lasting solution, as it does not deal with the root cause of the problem. Since the major cause is hormonal changes and other reasons, if your hormonal changes is not attended to, even if you are taking any medication to relax the muscles of your prostate gland or to reduce the size of the prostate gland, or surgery is recommended, still that is not a lasting solution because your hormones are not balanced or other reasons are not attended to. But what are the side effects of this open prostatectomy or transurethral resection of the prostate tube? Complications include infection, bleeding, urinary incontinence, and permanent erectile dysfunction. At Muse Healthcare, if you are struggling with prostate enlargement, the first thing we do is doing an investigative scan to understand what exactly led to benign prostate hyperplasia. After understanding what caused, if it's hormonal changes, we attend to those hormones, we balance those hormones and get rid of the inflammation. And if it's other reasons, we attend to those other reasons. At Muse Healthcare, we are specialized in QRMA investigative scan. This is a radiation-free scanning machine which gives us the details, the background of your condition. And we also specialize in American clinical natural medicine. This is natural medicine which is clinically researched and pharmaceutically manufactured. Get in touch with us today.